Optoline's been one of the easiest technologies to implement in the practice, and the reason why is that it works with everything, and it's an independent area that we don't. So that we don't utilize as much in clinic. In other words, we have a lot of technology, and we have I have a research room that's extremely large that's filled with all kinds of technologies and topographers and different imaging diagnostics, and yet we don't have anything that works in this area. So when we tried to correct for it, maybe with a 4-opter, which isn't really high-tech by any means, and try to figure out the alignment or pull out a prism bar and try to measure and get our answers from that, it's not high-tech to begin with. It looks like we're actually pretty low-tech. It looks like we're trying to solve it by trying different things, and the patient's trying to say, yeah, this might be better, this might not be. We're moving it up and down, moving paddles back and forth. So this technology fits in. Number one, it's high technology. It looks impressive. Patients look into it. They're able to get their assessment on 3 different tests. What's really fascinating is that it speeds up our flow. The time it used to take to measure alignments, to be able to figure out if that is a factor, even to be aware of it, is significant. And now, if I see patients that have any of those symptoms, I immediately order the test. In fact, it's gotten to the point now where I don't even have to. My staff, when they're doing the history, are so excited about this technology that the minute they hear those symptoms, they're attuned to it and they order the test or do it right away, even before I see the patient. So I would say it has increased our efficiency dramatically. It's more impressive to the patient, it's easier for them to use, and the accuracy then helps us to treat it. On occasion, I can do some little quick tests, like I can take a cover test, a little paddle, and go back and forth and see if I have an exophoric situation at distance. And that'll key me into doing the Optoline. But in most cases, symptoms really help us to determine when that test is necessary, and since it's so quick and effective, it speeds up our flow and efficiency. Because Optoline is so easy to administer as a diagnostic test, it makes sense that you could use it as a screening on every patient, and I bet you would uncover incredible amounts of issues, and you would solve patients' symptoms such that they will tell a lot of friends. The way that I'm doing it currently in my office, however, is to look at the certain symptoms that present. Or, because we're a referral center, we get a lot of patients sent in from other doctors. It's amazing how often these patients have had everything tested and still continue to have symptoms. And until I'd learned about Optoline, I had a number of times when I couldn't solve it either. And it is my job to kind of be in the last kind of step there in terms of referral process to solve those issues. Finally, we were able to find some of the answers in an area I never even thought to look at, and that's the proprioception and eye alignment. So I've learned to utilize it in patients where I can't find answers, just as I would do an endothelial specular microscopy or order another test. So I tend to use it in instances where there's certain symptoms or where I'm not able to solve their issues when they present, or not able to elicit certain signs based on those symptoms that are around irritation, sandy, gritty, headaches, that sort of thing. So we use it almost as a neurological test. We use it as a final diagnostic test when we're not sure. But truthfully, we could use it on every patient, and I bet we'd uncover incredible amounts of issues and help a lot of patients with the ability to read and use the computer and to function throughout the day, and even to eliminate headaches in many of these patients.